Okay, good morning to you, Abuja. This is another beautiful Tuesday right here from the staples of Rhythm 94.7 Abuja. The time now is 5 minutes to past the hour of 10. Today is the 27th day of November 2018. Your host today is Awesome Ann on the mid-morning cruise. And then, of course, we haven't fallen short of what we do every Tuesday. It's Healthy Tuesdays today. And this is powered by Nizamiye Hospital. We have another amazing medical practitioner in the building in the person of Dr. Asen Mustafa, and he's a general surgeon with Nizamiye Hospital. You're very welcome, sir. Good morning.
Good morning. Thank you very much.
Yes, I hope you started off great. I hope your morning is great.
Thank you, all of you.
All right. So we're going to be talking about breast cancers today. So if you are somewhere doing something, just take out the time right now. Increase the volume of your radio sets because he's here to educate on us everything we need to know about breast cancer. So let's get right into it, Dr. Asen. Tell us about, breast cancers. First of all, let's start with the breast, and the anatomy of the breast and everything that happens in there. Just a short intro.
Okay, thank you again. Hello, Abuja. I want to talk about the breast cancer. All of the women wants to know something in breast, which is happening, the functions or lumps in breast. So I want to explain something about your breast problem. The breast problem, worldwide, the breast cancer is the most frequently diagnosed life-threatening cancer in women and the leading cause of cancer death among the women. So in US, I want to give a few statistics to you. Actually, it's not so easy to say statistic for every country, but we can give small example from US.
Okay.
So in US, approximately 265,000 new cases of female breast cancer predicted to occur in 2018.
Oh, wow.
This is the predicted new cancers.
Wow.
We are not talking about who has a breast cancer now.
Right.
So apart from this, along 2,550 cases also in men.
Wow.
So
men.
Yes, also the breast cancer also we can see in men.
Right.
So, apart from this, the almost 60,000 cases, we are calling as a ductal carcinoma in situ or lobular carcinoma in situ. That means this very, very early stage cancer types.
Right.
So, it's not exactly cancer, but most 100% of these findings will convert to cancer later.
Right.
So almost 60,000 people.
Right.
It's okay. Okay, should I talk about the small anatomic
yes, please. Just a little bit of the anatomy of the breast.
Actually, anatomy is very... you can think like that. Anatomy is not interested to us. But I want to give small information about the breast structure because this type of cancer is related with the anatomic structure.
Okay.
So you can understand better what is the lobular carcinoma, what is the ductal carcinoma or something like that. The breast tissue has three main parts.
Okay.
One of them is ducts, which is allowing to pass milk, the ducts, or canal channels. Or another issue, lobes and lobules. And another structure is supporting tissue, like fats and fatty tissue.
Right.
So the cancer of breast occurs from these three parts.
Okay.
The most common one comes from ducts. We are calling ductal carcinoma.
Okay.
So if it occurs from lobes or lobules, we are calling lobular carcinoma.
Okay.
If it occurs from supporting tissue, there are different type names of this.
Supporting tissue.
Yes, mucinous carcinoma, something like that. According to type of cells, it's changing because there are a lot of types of the cells inside the supportive tissue. So, which cells causes to cancer? We are calling with its name.
Okay.
So the about function, the breast function related with hormones, the estrogen, progesterone, and
Right.
prolactin.
Okay.
Estrogen and progesterone affect so much the breast tissue. So also it's related with patient's period.
Okay.
But prolactin is different. Prolactin is milk. We can say is a milk hormone.
Okay.
So estrogen after the period enlarges breast tissue. Progesterone fills it with fluid and makes sensitivity and heaviness at the breast just before period.
Okay.
And also it can cause heaviness and breast pain. And prolactin stimulates the milk producing inside the breast tissue. Also inside the lobes, because the lobes and lobules produces the milk production.
Okay.
It stimulates it.
Okay, right. Okay, so we've been able to establish that there are three parts of the breast, or those parts are responsible for, a likelihood in the occurrence of cancers. You mentioned estrogen, you mentioned progesterone,
Yes.
and you've mentioned prolactin.
Yes.
But you said prolactin is basically for like milk production.
Yes, of
and
course.
then that means we'll be looking at people that have given birth, like people that are breastfeeding, maybe.
Yes, during breastfeeding, especially during breastfeeding,
Right.
prolactin hormones level increases
Right.
to stimulate the breast milk producing.
Okay, right. Okay, so let's go to the causes of breast cancer. What are the common causes?
Actually, the epidemiologic studies has identified a number of risk factors that associated with increased risk of woman breast cancer.
Okay,
So the first one is age and gender.
right.
Actually, I told you we can see breast cancer in men.
Yes,
Also,
you
but
mentioned.
the most risk to be a woman.
Right.
So the another risk factor, age. Before 40 age, the breast cancer risk is very low.
Right.
There are the incidence, specific incidence of the breast cancer is bimodal.
Okay.
They is doing double peak. So first peak around 50s,
Okay.
the second peak around 70s.
Right. But is it possible to have breast cancer in people younger than 50?
Of course, younger than 40 also.
Oh, really?
Yes.
So your experience, what's the lowest age, that you have
There is no
experienced?
lowest age.
Okay.
Also, I can give small one information about my sister.
Okay.
When she was breast cancer,
Okay.
she was 30,
Oh, wow.
30,
30.
31, yes.
Oh, wow. Oh, wow. So somebody as young as 30 can actually have...
Possible, but not so common.
Not so common.
Yes.
Okay. All right.
For this reason, screening starting after the 40,
Right, right.
generally.
Right.
And also we are making the frequency of screening, also we are increasing them after the 50s,
Right.
especially.
Okay, so how often should someone go to screen?
Actually, if you want, let me continue to the risk factors
Okay.
and epidemiologic factors,
Okay.
etiology also.
All right.
And also another, actually, remember me, I'll explain your question later.
All right,
It's
okay,
okay.
okay.
And there is another risk factor is family history.
Okay.
Family history is very important. A positive family history of breast cancer is the most widely recognized risk factor for breast cancer.
Okay.
If the mother or sister who affected with breast cancer,
Right.
the risk of breast cancer for their daughter and sister is 4 times more than normal people.
Oh, wow. Oh, wow.
So if the patient who has a relative, more than 2 relatives who has
Right.
a breast cancer
Right.
or other ovarian cancer together, which is related with estrogen,
Right.
because I'll explain you another risk factor is estrogen.
Okay.
So if the patient has 2 relatives who has a 2 ovarian or breast cancer, so the risk factor is 5 times higher than normal people.
Right.
So actually, if we add the gene analysis, it can reach to 30%.
Right.
The risk factor can be 30. during examination, if there are a few like this risk factors together with patient,
Right.
so after that time to suffer from breast cancer, risk is almost 30%.
Right.
So, well, I'll explain later what's the importance of these things.
Right.
So, let me summarize the importance, which type historical characteristics suggests increased cancer risk. In one of them is 2 or more relative with breast cancer or ovarian cancer.
Okay.
Another one, breast cancer, if the breast cancer occurring in an affected relative younger than 50 years. It's
Okay.
also an important risk.
Okay.
And relatives with both breast and ovarian cancer.
Right.
And also one or more relative with 2 cancer, ovarian and breast.
Okay.
And also if there is a male relative with breast cancer
Okay.
is important risk.
Okay.
And also I told you gene mutations.
Yes.
The BRCA1 or BRCA2 genes mutations can increase the breast cancer risk. I told you before, if there are 2 relatives with breast and ovarian cancer, and if this BRCA gene mutation becomes together,
Okay.
so these specifications becomes at the same time in patient's body, the risk to suffer from breast cancer risk is almost 30%. And
Right.
also sometimes without cancer, we can advise to removal of breast tissue for this high risk.
Right.
This is the important issue. And also reproductive factors and steroid hormones can affect the occurrence of the breast.
Okay.
And so late age at the first pregnancy, nulliparity, without children, if the patient didn't give any birth,
yeah.
also is important. And early onset of menses,
Okay.
and late age menopause.
Okay.
So associated with increased risk of breast cancer, prolonged exposure to elevated levels of sex hormones, explaining the association between breast cancer and reproductive behavior. What I'm trying to say, if the patient's body exposure to estrogen effects, this one increases to the breast cancer risk.
Right.
What I told you before, now the late age first pregnancy, because during pregnancy and during breastfeeding, the estrogen effects reducing. So I told you late age first pregnancy.
All right. So
Suffering from estrogen, it's exposing to the estrogen effects.
Okay.
And also nulliparity, if there is no pregnancy, estrogen hormone affects so much to body. And early onset, if the mens starts earlier, estrogen effects makes so much exposure to body. And also late menopause, same.
Okay. All right. So there are different things that we mentioned right now, but just in case you're just tuned in, this is Rhythm 94.7. We are currently talking about breast cancer, to be precise. But Dr. Ahmad Hassan Mustafa has actually given us an idea of the different, risk factors that we can be looking out for when it comes to, cancers. And we're looking at people that already, if we have relatives that already have cancers, male or female, if we have, exposure to certain, sexual activities at an early or at a late age, looking at menopausal activities, early menses, and then late could also be yes, and then we also look at menopause too.
All these activities related to increased estrogen exposure.
Exactly. So once there's increased estrogen exposure, then the chances,
Let me say another thing to you. Sorry, I interrupted your talking. So you know, some of the oral contraceptives also includes the estrogen
Okay.
and progesterone.
All right.
So
Right.
if the regular use of this oral contraceptive becomes so long time,
Right.
also the patient takes so much estrogen.
Right. So it increases the chances.
Exposure of the estrogen hormone is increasing.
Right.
So it can affect the chance of cancer.
Oh wow!
Risk of cancer.
Oh wow! So we just also noted something very important. If you are exposed to oral contraceptives and you take it for a long
Actually,
time,
there is no exactly evidence, but theoretically, all the doctors accept it. The estrogen oral contraceptive can affect small or more effects to breast cancer risk.
okay, all right. So we're going to go on this very quick break, telling you more about those that are powering this particular health segment. And when we get back, we'll be looking at opening up the phone lines, yes. But before then, we'll be looking at symptoms that you need to look out for if you have breast cancer, how it can be diagnosed, and of course, testing. We're looking at management, treatment, and then, of course, if you are already someone suffering from the disease, how to monitor, to be in the best shape. All right, stay with us. This is Radio 94.7, and we'll be right back.
Tune in every Tuesday from 10:05 a.m. on the mid-morning cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital.
Okay, yes, you had that right. That is the Nizamiye Hospital powering this particular segment of the show on the mid-morning cruise today. This is really 94.7. Time now is 22 minutes past the hour of 10, and we're currently looking at an ailment, breast cancer. We've looked at the risk factors, we've looked at the causes, we looked at the things that you need to be, wary about if you have a family history, if you have early menses, you have late menses, your menopausal rates. Those are the things that actually increase, the discharge of those hormones that might be, possible causes, right? So now we're looking at symptoms and how to diagnose, if someone has breast cancer.
Yes, actually most of the women scared from lump.
Yes.
And also breast pain.
Right.
But I told you, generally the breast cancer does not give so much pain.
Okay.
The most important sign about the cancer is lump.
Right.
But sometimes, without noticing any changing, it's possible to see breast cancer. So, for this reason also, we are advising to screening, to
Okay.
early detection, early diagnosis.
Right.
So, sometimes there is no evidence, everything looks like normal,
Right.
but it's possible to see breast cancer.
Okay.
So, for this reason, we are advising to check breast time to time.
Okay.
But apart from this, the most important sign about cancer is lump.
Okay.
So apart from this, there are a few different signs which is giving evidence about the breast cancer.
Okay.
One of them is the changing in breast size and shape.
Okay.
So, skin dimpling, skin changing,
Okay.
and nipple inversion,
Okay.
nipple abnormalities,
Right.
and blood discharging from nipple, and axillary or lump also, and lump in armpit also.
Okay.
So sometimes we can see squeezing down in the nipple,
Okay.
at the nipple or another part of the breast.
Okay.
So sometimes we can see dimpling when we press the waist together. It's becoming clear. It's squeezed down. We can see it.
Right.
And also bloody discharging also can be important because the discharging comes from milk ducts.
Okay.
So I told you before, the most common type of cancer in breast is ductal carcinoma,
Right.
which is occurring from ducts.
The milk ducts.
Milk
Yeah.
ducts. Also, ductal carcinoma can cause like this bloody discharging. Because of the breast physiology, breast working, sometimes we can see the whitish, yellowish, or greenish discharging.
Right.
This type discharging is not so important.
Okay.
But it needs also investigation. Is there any importance or not? But generally, it comes from high prolactin level.
Okay.
Because the prolactin increases during breastfeeding.
Right.
So if there is no baby, if the prolactin level increases, so it can cause like this secretion from milk ducts out.
Right.
So the most common reason is this. So if the patient comes with this problem, we are checking prolactin level.
Okay.
With lab analysis also.
Yeah, so is it possible to have a lump, and that lump, because sometimes I've heard different people, go for their screening or their checks and they have a lump, but they say the lump is benign. Is there supposed to be cause for worry, or is it something that is common? Can you give a lot more explanation to that?
Okay, there are two main lump, which we are calling them as a benign. This cystic disease, and also another one is fibroadenoma.
Okay.
The between 18, actually we can take it between 15 and 35 age. This type benign lumps are very common. So, but we have to confirm they are benign. So, if we notice any lump in our breast, for confirmation we have to check it we have to show it to general surgeon.
Okay.
Is it benign or not? Sometimes it needs further investigation, like fibrocystic disease or the fibroadenoma.
Right.
Both these problems does not convert to cancer.
Oh, okay.
But it can enlarge more. But first of all, we have to be sure this is exactly fibroadenoma or this is exactly fibrocystic disease. Because if the misdiagnosis, we are thinking this is fibroadenoma, it can be cancer.
Right.
So for this reason, we have to confirm it's exactly fibroadenoma or it's exactly fibrocystic disease.
Okay. All right. So we're going to open up the phone lines real quick. If you have any questions, any concerns. I mean, the question I just asked now is something that I know has bothered me. Sometimes you go to screen and then they tell you there's a lump. And once you hear there's a lump, the tendency for you to get so scared, is there. So you want to ask Dr. Asen any questions, 081-78000-947. Let me take it slower, 081-78000-947. So, or you could send concerns as a text message to that number, just in case you have any questions on, breast cancer, on diagnosis, on testing. We looked at risk factors, where right now we'll be looking at treatments and management.
Before treatment, I want to talk about the diagnosis of the breast. Is it possible to talk about this issue, diagnosis? How can we diagnose the breast cancer? So, there are three main issues for diagnosis. First one is clinical examination. Second one, imaging techniques. And third one is biopsies.
All right, so maybe a question coming in, please. Let's just take this. Hello? Hello, good morning to you. What's your name? Where are you calling from?
Hello?
Hello, we can hear you. What's your name?
Hello?
Hi, we can hear you. Good morning. Okay, we missed you, but you want to try and call us right back. 081-78000-947. It would be nice to hear your question or your concern.
Okay, the first step for diagnosis is the clinical examination. During clinical examination, we are trying to notice the contour change, of lump and skin tethering, nipple inversion, dilated veins, ulceration around nipple, and edema. We are calling as a pedo-orange sign, like the orange cover, the skin, and axillary lump.
Okay.
The most important sign about cancer is this. The reason of the orange cover sign is the lymphatic microcirculation at the skin is changing with breast cancer. So it's changing the breast skin's view.
Okay.
So it's important. And also the squeeze down to nipple and all the other skin can give sign about the cancer. And second step for diagnosis is imaging techniques.
Okay.
We are starting to check breast without from non-invasive to invasive.
Okay, can you explain that?
Non-invasive is, the ultrasound scan.
Okay.
Ultrasound scan shows is there any abnormality inside the breast tissue? Is it fibroadenoma, fibrocystic disease?
Right.
Apart from this, if there is any suspicious lump, it says this is suspicious.
Okay.
It can be cancer. It cannot say exactly this is cancer,
Right.
but it gives information it can be cancerous.
Okay.
So another test for imaging is mammogram.
Yes, that one's
Mammogram. If the scan says there is a suspicious lump here, we are taking mammogram from patient.
Okay.
So there are a few signs in mammogram, the microcalcification and other asymmetric density, increased density. So it can, like this, a few sign can show us it can be cancer, most probably cancer, 90%. And also, third stage is the biopsy. Actually, before biopsy, we can do another thing, this MRI, breast MRI.
Okay.
But breast MRI is not so easy to evaluate it, and also it needs the additional instrument to check it. Routine MRI needs to specific instrument
Right.
to do it. And also
is it
evaluation
expensive?
Actually, all the medical devices are expensive, but most important thing, the radiologist should be experienced about this issue for evaluation.
Okay.
And also, generally, we are preferring MRI to identify the metastatic, means is spread cancers also.
Okay.
So the last diagnostic material is biopsy.
Okay.
There are a few types biopsy for lump. One of them is fine needle biopsy, fine needle aspiration biopsy, and second one is true cut biopsy or core biopsy, and third one is open biopsy. Fine needle biopsy, we are using normal syringe.
Okay.
And we are inserting syringe. We are aspirating some cells through this way, through the syringe, and we are sending it to pathologic investigation with slides. So, this type, the biopsy, if the result comes as a cancer, most probably is correct.
Okay.
But if the result comes as a normal, there is no cancer, we are not believing. There is 30% it can give false negativity.
Okay.
So it's not.
It's not
sometimes
like very accurate.
we are not preferring it every time.
Okay.
The true cut biopsy is more reliable than this one.
Okay.
With small local anesthesia. The true cut is thick needle, an automatic needle.
Okay.
We are inserting thick needle. We are picking sample from tumor.
Okay.
Also, we can do it directly with finger.
Okay.
Or we can do it. The best one is ultrasound guided or mammogram guided biopsy.
Okay.
Is also possible. Directly, we are inserting it inside the lump. We are picking specimen from there directly. This is the true cut biopsy.
Right.
We are preferring so much to this biopsy.
Okay.
Because another type is incisional or excisional biopsy. We are opening the breast tissue. We are removing lump from there. Why we are preferring the true cut biopsy? If the result comes as a cancer, the manage of the main surgery.
Okay.
Because after the diagnosis, patient needs to further surgery, bigger surgery.
Right.
So to manage it about incision and others about spreading is easier. If we do open surgery, sometimes incision, sometimes the other problems can affect to the estimate other problems. It can bring difficulty. So we are preferring to do true cut biopsy for diagnosis. And also, I want to talk about management of the problem after the diagnosis. If the result comes as a cancer,
okay.
So there are three different way to manage it.
Okay.
First one is surgery, second one is radiotherapy, and third one is chemotherapy.
Okay.
Actually, three of them related with stage of cancer. But generally, in the Western countries, the diagnosing the cancer is at the early stage.
Okay.
The stage 1 or stage 0, stage 1, stage 2. If the problem diagnosed at the early stage, we are trying to save breast. We are removing lump alone together with healthy tissue which is around the lump.
Okay.
And also we are cleaning to armpit. Is there any spreading? Because the breast cancer spreads most commonly in the ipsilateral armpit, same armpit.
Right.
So we have to clarify the armpit, is there any spreading? Because this spreading affecting to staging.
Right.
So according to staging, the oncologist giving decision about the chemotherapy or radiotherapy.
Right.
So we are another thing. I'm trying to say if we detect cancer at the early stage, the patient's comfort will be more.
Right.
So the breast protective surgery, we are applying the breast protective surgery. But if the patient comes as the advanced stage, so it's not so easy to save breast completely. So we are removing breast with surgical issue completely, and we are cleaning armpit again.
Right.
This is the modified radical mastectomy, we are calling like this. So we are sending them again to pathologic investigation to understand which stage.
Okay.
And apart from this, I told you there are a few management techniques, the radiotherapy and chemotherapy. Most of the, especially invasive ductal carcinomas, is sensitive to radiotherapy also.
Right.
And also, I told you the breast protective surgery has three things. One of them is lump excision, and axillary clearance, and radiotherapy. If we do three of them at the same time, this is the best solution for early stage cancers.
Right.
Without removing whole breast completely. So the radiotherapy is very important for breast cancer. So, but apart from this, the chemotherapy. For chemotherapy, I want to say two different things. One of them is hormonotherapy. I told you the most important hormone which is affecting to breast cancer is estrogen. So hormonotherapy, instead of estrogen, we are giving another drugs to block estrogen's effect.
Right.
And also other chemotherapeutic drugs.
All right. Okay. So we've gone through so much, right? Trying to understand how to manage cancers and what stages these cancers are at. Doctor mentioned surgery. You mentioned radiotherapy. You mentioned chemotherapy, and these are supposed to be at different stages of the cancer, right?
Yes.
And then you also mentioned different types of testing, using the fine needle, using the TrueCard. But you mentioned that the TrueCard is the most reliable because the fine needle will not do as much or get as much information as the TrueCard will. I've got a couple of calls that came in. We'll quickly take one or two of them. If you are still there, 081-78-000947. This particular segment of the show today is powered by Nizamiye Hospital. And then, of course, we've got Dr. Asin Mustafa, who is a general surgeon with Nizamiye at the hospital, and he's here present answering your questions if you have any questions, right, to ask, right? So we've looked at treatment, and then how do you monitor breast cancer?
Yes, breast cancer monitoring, screening is very important. I'll try to say within a few minutes this issue. The first one is self-examination.
Okay.
We are advising self-examination monthly. Before going to bathroom, we have to remove all clothes, and we have to go opposite to mirror.
Right.
We will put both hands to waist, so we have to do pressure to waist. is there any change at the breast,
Okay.
and squeezing down the deviation to right side or left side of
Okay.
the nipple
Okay.
is important. And after the 20 age, it can be before the patient should lie so the left breast for right hand without only with direct pressure, not like this. How can we say? We squeeze it so much with finger.
Okay.
We will try to check, and also right breast for left hand, and also we have to check armpit, both armpit,
Right.
monthly.
Right.
If the patient notice any changing, they have to go to doctor.
Okay.
And also when the patient go to doctor, the ultrasound scan should be regular check till to 40.
Okay, so let me quickly ask the question I asked earlier on. So how often do you get to screen, like for your checks?
Self-examination?
No, for the screening. You know, we talked about the self-examination. So
Self-examination monthly.
Okay.
Ultrasound annually.
Annually, okay, so once a year. Okay.
Till to 40 age. When the patient arrived at 40, we are adding mammogram.
Oh, okay.
After the 40, there are different ideas about screening.
Okay.
So it can be to every, if there is no risk factor, family history and others,
Right.
every 2 years enough.
Okay.
After the 50, every year, ultrasound scan and mammogram
Right.
together.
Right.
Even if there is no complaint.
Right.
And also MRI, we are not using MRI for screening. If we notice any suspicious lump or if we are thinking this is a cancer, at that time we are using MRI.
Okay. All right. That was very detailed. We missed a couple of calls, but yes, we'll do this every other Tuesday from 10:05, right? We're way behind time, but I needed a doctor to actually explain these things in details because there's so many questions that come in, especially with regards to cancers, and the emergence of cancers is getting a lot, especially for Black women these days. So the importance cannot be overemphasized. So we're very thankful to you, Dr. Asin Mustafa, for coming over to the studios and giving us a detailed, approach to things we need to know about breast cancers. Now, one thing I know that the awareness is going everywhere is you need to detect on time. Self-examination is key. Your frequent screening is also very key. I mean, this is the only way you can understand what's happening with your breasts and identify on time.
Even if you have a lump, even if you know it's benign, it's fibroadenoma, if you notice new one,
Right.
don't give decision yourself. This
Right.
is the same of the others.
Right.
You have to confirm it with doctor again.
Okay, so yep, that is how we will end the show for today. We're so thankful. I mean, lots of information. I learned a lot of new things like fine needle, true card, things like radiotherapy, chemotherapy, and then most importantly, the three means by which some of these cancers can come to you through your lobules, your supporting tissues, or the milk ducts. Yeah, I learned that one today. All right, so this is how we do it every other day. We're going to be going on to regular programming. All right, this is the Mid Morning Cruise. Awesome Man is your host, and of course today remains Tuesday. Pink Room, Blue Room from the 11 o'clock hour. Stay with us even as we continue to make you feel good today. All right.
Identify with the rhythm on Rhythm 94.7 Abuja.
Tune in every Tuesday from 10:05 a.m. on the Mid-Morning Cruise at Rhythm 94.7 Abuja as we discuss health-related